Hello and thank you for choosing St. Vincent Health Center for your heart surgery. We have developed a plan to provide you with comprehensive heart care, from diagnostics to surgical and non-surgical, cardiac rehab, and education. The continuum of care offered by the St. Vincent Heart Team and the Regional Heart Network eliminates the need to travel from physician to physician throughout the region for different services. At St. Vincent, our innovations in heart care meet and exceed state and national standards. We have the most experienced heart specialists, the latest life-saving technology, with a highly skilled staff of nurses, pharmacists, and dietitians, all focused on personalized care for our most important goal, and that's you. At St. Vincent, we know how to treat people. This video will explain what will happen before and after your heart surgery. Now, some anxiety is normal. We hope this video will help to provide you with information that you and your family can use to help in your recovery. It's a good idea to keep a notebook for questions you may have for your surgeon, or to take notes while you watch this video in case you have questions later.
It's the main valve between the pumping chamber, which on this model happens to be
your cardiologist has referred you to a cardiac surgeon. You will meet with the surgeon and he'll explain the procedure to you, along with the risks and benefits of the surgery. You and your doctor will decide the best course of treatment for you.
Carrying on the function of your heart and lungs.
Depending on your individual situation, your surgery may be scheduled in the next day or two, or you may be discharged from the hospital and return for your surgery.
Hi, Mr. Coletta. This is Jody calling from the admitting office.
To better serve you, and in order to streamline the registration process, a representative from St. Vincent will call you on the phone prior to your surgery. You'll be asked a series of questions so that we may have all of the information necessary to complete your surgical registration.
I look forward to talking with you.
You will be asked to select one person as your healthcare representative, who will talk to your doctors and nurses about your care and then update other family or friends if you so choose. Understand that St. Vincent will only provide your health information to this designated person, and we cannot give out patient information over the phone. This is for your privacy. During heart surgery, it is routine to use devices and life support systems that might be considered extraordinary in other situations. For that reason, it's suggested that you have a durable power of attorney for healthcare and/or a living will. Please bring copies to the hospital on the day of your surgery. If you need more information, visit the St. Vincent website or call St. Vincent Care Coordination at 814-452-5300. The day before your scheduled surgery, expect a call from St. Vincent between 2:30 and 4 p.m. If you're not home, we will leave a message directing you to call us back at 814-452-5408.
One new message.
At this time, you will learn what you can eat and drink before your surgery. You will be asked about your general health to ensure you are in good health and your surgery can take place as planned. And finally, we will let you know what time to come to the admitting department on the day of your surgery. In this segment, we'd like to tell you what you can do the day of your surgery and what to expect when you arrive here at St. Vincent. Patients already in the hospital will be instructed by our heart care team on the steps they need to take to prepare for surgery. You should not eat or drink anything after midnight on the day of your surgery. You may have a sip of water to take medication that your surgeon has indicated is appropriate for you to take on the morning of your surgery. Before coming to the hospital, you should shower, wash your hair, and be sure to remove any nail polish. Please don't wear makeup because your skin and nails allow the medical staff to monitor signs of circulation. You should leave any valuables, jewelry, or watches at home. And ladies, please bring a bra that closes in the front. For your convenience, this style is available in the St. Vincent gift shop. You should also arrange for a friend or family member to bring you to the hospital, pick you up, and bring you home upon discharge. On the day of your surgery, you should come to the hospital 2 hours before your surgery is scheduled. The admitting department is located here on the first floor of the hospital, just inside the main lobby and the circular drive. please have your driver's license and insurance cards available for verification. Since we have already obtained your registration information, expect to sign just a few forms related to billing, insurance, or Medicare, and to verify the information we have for you in our files.
Frank, how you doing today? How are you? Dr. Potiphar from the anesthesia department.
And now you will be taken to the preoperative area of the hospital, where you will be prepared for your surgery, and again, you will be asked a series of questions. You'll be asked to sign an informed consent, which indicates that you and your surgeon have talked about your surgery and that you know the risks and benefits and that you know what to expect after surgery. As a safety check, you will be asked the same questions many times. That's because patient safety is very important at St. Vincent, so we repeatedly cross-check your answers with the forms from your doctor's office. Before your surgery, you must remove any glasses, contacts, jewelry including body piercings, dentures, hair accessories, and undergarments. Your family will take these items and bring them to your room after your surgery. If you're having valve surgery, you and your family will be asked to confirm your choice of either a tissue or a mechanical valve. If you have any questions about this, please ask your surgeon or nurse. Please understand that while you may have a scheduled time for your surgery, we cannot guarantee a specific start time. Each patient is unique, and some cases may take longer than others and therefore could delay the next patient. In some cases, an emergency may even force the cancellation of a scheduled surgery. But please understand that we do our best to ensure that your operation starts on time. When you are transported to the operating room, your family will be directed to the Heart Center Family Resource Center, located on the 3rd floor of the hospital. Our family liaison will keep your family informed of your surgery's progress and can also provide them with a pager so they may be easily contacted. If you're having bypass surgery, an incision will be made in your leg to retrieve pieces of vein that will be used for the bypass grafts. Most of the time, the veins are removed with a surgical telescope. This is called an endoscopic vein harvesting, and it allows for the removal of long lengths of vein. When using this scope, it is possible you will have bruising on your leg. An artery in your chest called the mammary artery may also be used for one of your bypasses. Once your surgery is over, your surgeon will meet with your healthcare representative to let them know the results of the surgery and answer any of their questions. You will be taken directly from the operating room to the Cardiovascular Intensive Care Unit, that's CVICU, located on the 3rd floor of the hospital. You should expect to be here for a day or two. The length of your stay will be determined by your surgeon. Your family may visit you at set times throughout the day, and only 2 visitors at a time are permitted. We encourage the visits to be short to avoid tiring patients and to allow us to focus on the care, comfort, and privacy of all of our patients. In the waiting room, our family liaison will help your family and answer any questions they may have about visiting hours. All heart surgery patients have a breathing tube, and they are connected to a breathing machine, a ventilator, for several hours after surgery. This will stay in place until you are awake and ready to breathe comfortably on your own. You won't be able to talk because of the breathing tube, but the nurses caring for you are experienced at understanding and anticipating your needs. These tubes, pacing wires, and catheter are usually removed on the first day after surgery. To help prevent infections, friends and family members who may have a cold or the flu should not visit you after surgery. And anyone who does visit should practice hand washing before and after they enter your room. Your hospital stay may be longer in CVICU if you have difficulty breathing on your own, more bleeding than expected, problems with your heart rate, rhythm, or blood pressure, or other unexpected problems. Because good nutrition is important to help you heal, you will be given a heart-healthy diet when you're able to tolerate it. We will start you out on ice chips, then clear liquids, and your diet will advance based on how well you tolerate eating. Our goal is to have you sitting up and beginning to move by the day after surgery. This will help you recover and avoid complications. Your nurses will help you get out of bed and walk the day after surgery. We'll also encourage you to get out of bed for every meal. A day or two after your surgery, you'll be moved from the cardiovascular intensive care unit to 3 North, a step-down unit or a regular room on the heart floor of the hospital. Here, your family can visit you anytime from 8 a.m. through 8 p.m. And it is here where you will be up and moving, walking the road to recovery at least 3 times a day.
You walk 60 feet, you're doing well. Each day you'll walk a little further.
There are hearts hanging from the ceiling in the halls. Each marks another 20 feet. At first, you will walk with a staff member, and then family members may walk with you. We encourage you to walk to at least 1 additional heart each time you walk. You should also move to a chair and sit up for all meals. You may shower with assistance once all of your tubes are removed, and your nurse will help you. We prefer patients to do as much as possible for themselves, but we encourage family members to participate so they become more comfortable caring for you when you return home. After surgery, some patients will have a rise in blood sugar, which can be caused by the stress of surgery or the result of medications.
Here to test your blood sugar.
Since studies show a link between high blood sugar and complications, your nurse will check your blood sugar often. If it's high, it will be controlled with insulin. About 75% of our patients benefit from insulin therapy after heart surgery. There is additional information on blood sugar and diabetes on SVTV. That's the in-room St. Vincent television system, which provides educational videos, as well as TV channels, movies, and internet access. Lung problems are the most frequent complication after heart or lung surgery, so expect your nurses to provide you with extra oxygen, elevate the head of your bed, and help turn you from side to side. We encourage coughing and deep breathing using this plastic device, which measures how deeply you are breathing. You will also use a cappella or the pickle every hour you're awake to help loosen mucus in the chest. The heart pillow and heart hugger around your chest help make it easier for you to cough, breathe deeply, and begin to move about. You need to be comfortable enough to do the breathing exercises and to begin to move, so you will be given pain medication to control your pain. Do not be afraid of becoming addicted. It is normal to need pain medication after surgery, and the amount of medication will decrease over a few weeks' time. Please ask for pain medications to control your pain, and don't let the pain get too severe before notifying your nurse. This next segment will address many of the things that will happen in the hospital as you prepare to go home. Before you go home, you and your family will attend an open heart surgery class in the hospital, where our staff will explain your follow-up care and provide written instructions. It's important to have a friend or a family member there to listen to the instructions with you. You will follow up with your heart surgeon and cardiologist 4 to 6 weeks after you're discharged, and if possible, that appointment may be made before you leave the hospital. You'll be provided with a written list of medications, and you'll be given prescriptions for these medications. Let the nurse know if you need any special arrangements made for your prescriptions, such as extra scripts for mail orders. For your convenience, these prescriptions can also be filled upon discharge at Pharm SV, our in-house pharmacy located on the first floor of the hospital near the gift shop. After discharge, you may need chest x-rays and blood work. You will be given prescriptions for these if you need them, or you can have these done closer to your home. If needed, the surgeon and social worker may set up a visiting nurse to come to your home and check your blood pressure and your incisions. If your insurance allows, you'll also be asked to attend a cardiac rehabilitation program, usually within 2 to 3 weeks after the day of your surgery. Cardiac rehabilitation is a series of 1-hour exercise sessions, which will help you regain your strength. Your heart is monitored during all of the sessions. Each session includes a warm-up phase, which prepares your heart and other muscles for exercise. An aerobic period where you will use bicycles, treadmills, and weights. Light strength training. A cool-down phase which gradually returns your heart rate and circulation to a pre-exercise state while increasing your flexibility. The heart experts here at St. Vincent want to ensure that you heal and are able to resume your normal lifestyle. So here is information on many common concerns. First, if you think you need immediate attention, do not hesitate. Call 911. For all other concerns during the next 30 days, you should call the heart surgeons during normal business hours. Call 814-456-9197. After 4 p.m. or on the weekends, you should call the main number at St. Vincent, 814-452-5000, and the operator will connect you with the heart surgeon who is on call at that time. Non-urgent calls and prescription needs should be made during normal weekday business hours. Many patients experience some shortness of breath during the first month after surgery due to the healing process of the lungs. Continue your walking program and use your spirometer. But if you're concerned, please call the heart surgeons, who then may schedule a chest x-ray or suggest that you come to the office or emergency room. Your leg with the incision may swell, so be sure to elevate your legs on a pillow at night or keep your legs up when sitting for any length of time. Walking will also help to reduce swelling. Again, call the heart surgeons if you're concerned about continued leg swelling. Your chest incision should not be red. Your leg incision may have a ½ inch of redness along either side due to a reaction to the sutures. You may also have clear fluid draining from the incisions. Call the heart surgeons if the redness or drainage increases in your leg, or if either the chest or leg incision becomes warm or tender to the touch. Shower daily, allowing warm, soapy water to run off the incisions, and pat these areas dry with a clean towel. Atrial fibrillation, or AFib, is an irregular heart rhythm. It's not uncommon after heart surgery and is most frequently treated with medications. As your heart heals, the rhythm will become normal. But if you notice that your heart rhythm becomes fast or irregular, call the heart surgeons or go to the nearest emergency room. Aches and pains are common after open heart surgery. In fact, it's normal to have some discomfort around your whole upper body for 4 to 6 weeks. Gentle stretches and warm heat may help. You may use pain medication as approved by your surgeon. It's important to resume activity. Climbing stairs is okay, but go slowly and don't use the handrail to pull yourself up the stairs. You may begin to drive 4 weeks from the day of surgery if you're not taking pain medication. You have been given a heart-healthy meal plan which you should follow immediately. This means eating less cholesterol, fat, sodium, or salt, and less sugars and sweets. Try to focus on foods high in iron, which include lean red meat and green leafy vegetables for the first 8 weeks. For more information, contact the St. Vincent dietitians at 814-452-5300. It is normal to have mood swings after surgery. It's normal to cry, feel sad and frustrated, and even angry. But if these feelings become uncomfortably strong, please contact your family physician. Once again, we would like to thank you for choosing St. Vincent Health Center for your heart care. We believe in education before, during, and after a patient receives treatment, and we involve family members to complete the circle of care, because your success is important to us. Our commitment to quality and to you never ceases. That's why more St. Vincent Heart Center patients go on to live fulfilling, happy lives. At St. Vincent, we know how to treat people.